The PA in left lateral chest is a very common routine that you'll be seeing out in clinical. Now, when you get your patient standing at the chest board, you're going to have to determine, according to the size of the patient, if your image receptor is going to be placed lengthwise or crosswise. For many of your men, the image receptor is going to be placed in the bucky crosswise because of the width of the chest. Now you want to double check and make sure that you do see a little light field above the relaxed shoulders, and usually that's going to be about 1.5 inches. Have the patient facing the board, and then ask your patient to put the backs of their hands up on their hips. And what this does, it moves the scapula out so that you can see more of the lungs without that superimposition of the scapula. Also, you want to double check and make sure that your marker is on here. So I have my left marker placement right here in the upper left corner of the IR. So once you have your patient in position, the important thing is that you get your exposure made on full inspiration. Best way to do this is to ask your patient to take in a deep breath, blow that breath out, take in another deep breath, and hold it. And what this does, you'll be shooting the exposure at maximum inspiration of the lungs. Okay, you can relax. Next we will do the lateral, and with the lateral the patient will put their left side up against the chest board. And I can turn the image receptor around so that it is in the bucky lengthwise. Now, if your patient is very broad-chested from anterior to posterior, you may have to leave it in the crosswise position. But your light field is going to be 1.5 to 2 inches above the shoulders. Make sure that the patient is good in lateral. You don't want them standing on one leg versus the other leg or have them obliques. You want to be sure that they are good in lateral. Okay, and then have them raise their arms over their head. Okay, put the side into the board. Since it's the left side, we can leave our left marker on the board because that is indicating it is a left lateral. One more thing you want to check is to check your line, making sure that it is mid-coronal. And you can come beside your patient, evaluate the posterior ribs, make sure they are superimposed on top of each other, as well as making sure that you have the anterior portion on as well. So with the lateral chest x-ray, you'll do the same routine regarding inspiration. You have them take in a deep breath, blow that breath all the way out, take in another deep breath, and hold it. And then it's at this point you would take your exposure. Now you can breathe, David. You have to watch your patient as they're breathing, because when you take that exposure, you want to make sure that they have taken in that breath and are holding it. Okay, so this is our routine PA and left lateral chest.